You ever stop and wonder what's actually going on behind the scenes when the world tries to, save millions of lives from disease? Well, there's a system for that. You can think of it like a global operating system for health. And just like any OS, it's got its strengths, but as we're about to find out, it's also got some pretty serious bugs that need fixing.
So, back at the turn of the millennium, the world set these incredibly ambitious goals to fight poverty and disease. I mean, we were aiming high, talking about saving millions of people. But when the deadline rolled around, we fell short. So, the big question is why? What happened between making the promise and getting the results? And this chart really drives that point home. Just look at child mortality. The target was a two-thirds reduction. What we got was 53%. Now, don't get me wrong, that is an incredible achievement that saved millions of kids' lives. But it was still a miss. And we saw similar stories for other goals, too. It wasn't for lack of trying. So something else had to be going on here.
And that whole experience taught us a really crucial lesson. See, announcing a big, bold goal, that's the easy part. The real work, the truly hard part, is building and running the huge, complicated global system you need to actually deliver on that promise. It really forced everyone to take a hard look at the machinery of global health itself.
So let's dig into what this machinery, this operating system really is. Because it's the invisible architecture that decides whether life-saving work succeeds or fails on a global scale.
The official name for it is Global Health Governance, or GHG for short. Basically, just think of it as this tangled web of rules, organizations, and decision makers, everyone from the UN and national governments to huge private foundations. They're the ones who collectively decide which health issues get attention, who gets the money, and how help actually gets delivered on the ground.
You know, this system wasn't always so complicated. For decades, the World Health Organization was pretty much the main conductor of the orchestra. But then, starting in the 90s, new players like the World Bank and major foundations jumped in. And today it is a super fragmented landscape. We've got more players and more money than ever before, but trying to coordinate all of them has become this monumental challenge.
Okay, so if we're going to treat this whole global system like a patient, it's time for a diagnosis. What are the critical failures? What are the bugs in the code that are really holding it back?
First off, let's just be clear about the stakes. We're talking about diseases like HIV, TB, malaria, and a whole bunch of other neglected diseases that affect over 1 billion people. That's billion with a B, mostly in the world's poorest communities. So the human cost of a system that isn't working right is just immense. Now, to really get the system's flaws, you gotta follow the money. This snapshot here shows where the funding is coming from. See that biggest slice? That's bilateral aid, money going directly from one country to another. Then you have multilateral funding, which is money pooled from different countries and managed by big groups like the Global Fund. And then, of course, there are these massive private philanthropies. This setup creates some very specific power dynamics. And those power dynamics create a really fundamental problem. When the money comes from outside donors, it's their concerns and their political priorities that often end up setting the agenda. And that agenda might not line up with the most urgent needs of the people on the ground. Which leads us right to these 4 critical weaknesses. Number 1, a lack of participation. Local voices just get drowned out by the big donors. 2, a lack of transparency, which makes it incredibly hard to track where the money is actually going. 3, political unaccountability. I mean, donor agencies answer to their own governments, right? Not the communities they're supposed to be serving. And finally, number 4, operational inefficiency. You get different groups doing the same thing, and frontline workers just get buried in paperwork. All right, so it would be really easy to just look at all that and conclude this whole fragmented system is a total mess. But here's the twist. When you get a second opinion, you find that this chaotic, messy system actually has some surprising and really powerful strengths. And this is the part that's so surprising. The system's biggest weakness, the fact that it's so fragmented, is also a source of strength. It allows for incredible innovation because different groups can all try out new ideas. It gives it flexibility, since smaller organizations can adapt to local needs way faster. And it attracts this diverse, highly motivated workforce of innovators and entrepreneurs. Let me give you a real-world example of this. Doctors Without Borders, MSF, they developed this brilliant model in Africa called adherence clubs. It was all about helping HIV patients support each other and stick to their treatment. And it worked so well that it was eventually adopted by national health programs and even major funders. That's exactly the kind of ground-up innovation this kind of system makes possible.
So, what we have is a system with some really deep flaws, but also some unique strengths, which brings us to the final and most important question. How do we write the prescription? How do we go about reforming the code?
Look, the road ahead is definitely not easy. We're facing threats like funding that's flattening out and just general donor fatigue. But inside that challenge, there is a massive opportunity. The chance to build a system that finally addresses its core weaknesses. A system that's more inclusive, more transparent, more accountable, and way more efficient.
And that right there is the delicate balancing act. The goal isn't to just tear everything down and start from scratch. If we did that, we'd destroy the very things that make the system so innovative and adaptable. The real challenge is to reform the weaknesses, like the lack of accountability, while being really careful to protect the strengths. Which leaves us with this one final critical question. And honestly, the success of global health for the next generation really depends on how we answer it. How do we fix the bugs? The bugs in accountability, transparency, and efficiency, without crashing the entire, complex, and sometimes brilliant operating system that, for all its flaws, is still out there, saving lives every single day.